Good morning, my name is Lady Laura Marela Orellana. I decided nursing in Santiago de Guayaquil Catholic University. I am talking about of prostate cancer metastasis. Further definition. Prostate cancer is marked by the controlling malignant growth of cells in the prostate gland. The prostate is the one on the side gland in men it produces and storage food has helped to make semen. And is able to irrelevant better control. Prostate cancer is the most common type of cancer found in men in the use. Aside for skin cancer often begin without symptoms. Approximately 1 in 4 in 1 men will die from prostate cancer. Prostate cancer can be seen is the seed often most men diagnosed with cancer don't die from the disease. Prostate cancer can be low-grade social meaning and they or disease before the prostate cancer can significantly prolong hard weather. Many prostate cancer are more aggressive against spread of say the campus or the prostate glands, which can be deeply the prostate cancer survival rate is really improved the early detection and personality training.
Considerations in advanced prostate cancer. Prostate cancer is the most commonly diagnosed cancer among men in the United States, excluding certain skin cancers. A common misperception about prostate cancer is that it is rarely fatal. In fact, it is the second leading cause of cancer-related death among men in the United States. While it is true that prostate cancer is largely curable when diagnosed and treated early, patients with advanced prostate cancer have a less favorable prognosis. Advanced prostate cancer is defined as cancer that has spread beyond the original tumor. The most recent statistics estimate that 3 out of 10 men are still alive 5 years after being diagnosed with advanced prostate cancer. Male hormones, such as testosterone, cause prostate cancer to grow and survive. Early treatments for prostate cancer attempt to lower levels of testosterone in the body. This is known as hormone therapy. However, prostate cancer tumors may eventually begin to grow again, even though levels of testosterone in the body are low. At this point, the cancer is considered to be advanced. Researchers are studying why this occurs to gain a better understanding of how to develop treatments for prostate cancer. Talk to your doctor about questions you may have about advanced prostate cancer. Recent basic science and medical evidence suggest that one possible reason that tumors continue to grow is that they become extremely sensitive to the low levels of testosterone that surround them. In this way, tumors can grow even though there are extremely low levels of testosterone in the bloodstream. Additionally, studies done in both animals and humans show that the tumor may begin to produce its own supply of testosterone. This means the tumor is capable of fueling its own growth. In other words, in advanced prostate cancer, there is evidence to suggest that the tumor may be providing its own testosterone so that it can grow without depending on other sources of testosterone production. Talk to your doctor about new information regarding advanced prostate cancer.
Application in nursing. The nursing staff in front of a patient with metastatic prostate cancer must privilege health control and alleviate the pain with the spray medication. They will also monitor drains, catheters, and the appearance of any physical change that may appear in the patient. As any other disease will also be essential to information the patient about the extent and evolution of their disease and provide the necessary emotional support. Prostate screening tests may include digital rectal exam (DRD). A lubricate global finger is inserted in the rectum to examine the prostate that is adjacent to the rectum. If there is any anomaly in texture, shape, or size, your may filter testing.
If you've been diagnosed with prostate cancer, you may feel upset, scared, or like things are out of control. Prostate cancer and its treatments can affect every aspect of your life and daily routine. One of the ways you can take back control is to learn about the disease and what you can do. Prostate cancer is the most commonly diagnosed cancer among men in Canada. 1 in 9 Canadian men will be diagnosed with prostate cancer in their lifetime, so you are not alone. In fact, when you receive your diagnosis, you'll be introduced to a team of healthcare professionals who will support you, including your urologist, nurse, and possibly a medical oncologist or radiation oncologist. You and your healthcare team will talk about your diagnosis and the different kinds of treatments. You should be part of the decisions to choose the treatments that are best for you. So what is the prostate? It's part of the male reproductive system. It sits below the bladder and in front of the rectum. The prostate's job is to help form semen by producing fluid that mixes with sperm from the testicles. Prostate cancer happens when normal cells in the prostate grow faster or die more slowly than usual. This leads to a cancerous tumor over time. It helps to know some of the words that your healthcare team will use so you can understand the disease. The grade of your tumor and stage of your disease are important to know and will help you and your team decide which treatment is best. The grade of the tumor refers to how abnormal the tumor cells look under a microscope when compared to normal cells. It tells your doctor how quickly the cancer may be growing and how likely it is to spread. The cancer stage describes how big the tumor is and whether it has spread outside the prostate to other parts of the body. If the tumor is found only in the prostate, it is called localized prostate cancer, and it includes both stage 1 and stage 2 disease. Stage 3, or locally advanced prostate cancer, is when the cancer has spread outside of the prostate to nearby areas of the body. Stage 4, or metastatic prostate cancer, is when the cancer has spread to lymph glands or other parts of the body such as bones, liver, or lungs. It's important to know that most early-stage prostate cancer can be treated successfully. In some cases, the tumor will grow so slowly it can be monitored with active surveillance, which can delay or avoid other treatments. Other types of prostate cancer treatment include surgery, radiation therapy, hormone therapy, which is referred to as androgen deprivation therapy or ADT, and chemotherapy. The treatment you and your healthcare team choose will depend on the stage of your cancer and your overall health. Some of these treatments may cause side effects that can affect your daily life. That's why it is important to think about your lifestyle when you are looking at the different treatments for your disease. At your next appointment with your healthcare team, make sure you tell them what is important to you as you consider the different kinds of treatment. For example, sexual intimacy with your partner may be important to you, so you may decide on a treatment that will have fewer sexual side effects. Don't be afraid to ask your healthcare team for advice. It's also common to get a second opinion if you need help choosing the right treatment for you. Understanding your diagnosis and working with your healthcare team will help you take control of your life with prostate cancer. To learn more about prostate cancer, visit prostatecancer.ca.
Pros and cons. There are several options of the treatment of prostate cancer, but the most important is surgery, the removal of the prostate, and some rather than chemotherapy. The use of the drugs or destroy cancer cells usually be keeping the cancer cell from growing, dividing, and making more cells. Radiation therapy. Use of high energy rays to destroy cancer cells. Complication. Cancer that spread metastasis. Prostate cancer can spread the hair organs such as your bladder or travel through your placenta or liver in systems to your other organs. Incontinence. Both prostate cancer is extreme can urinary incontinence. Usually applied in Ecuador. In Ecuador, according to Solca study, prostate cancer occupies the first place in order or frequency of cancer in men, also generating in the high mortality rate and its survival has improved thanks to the detection of the disease. Risk factor. Age. The risk increase with age. Specificity and 60 years of age. Although this does not exclude that occur in your men between 40 and 15 years of age. Back rate is more frequent in black men than in white men, and in recent years an increase of the disease has been observed in state men.
Hi, I'm Dr. John Lynch. I'm a urologist and I specialize in treating patients with prostate cancer. Not only am I a doctor, I'm a prostate cancer survivor, so I know on a very personal level how difficult and scary it is to get the diagnosis of cancer. A cancer diagnosis is never easy to hear, and the emotional impact can be significant. What is important to remember is that, unlike many other cancers, most prostate cancer never becomes life-threatening. And if you've been diagnosed with localized prostate cancer, there are many treatment options available. Although prostate cancer is the most common cancer in men, it's also one of the most treatable, particularly when detected early. If your doctor has told you that you have localized prostate cancer, that means that the cancer has not moved outside of the prostate. You have a lot of very effective treatment options available. Deciding what treatment you should get can be complex. It depends on how much the cancer has spread, known as the stage of cancer, and how it looks under the microscope, known as the grade of cancer. It also depends on your age, health, and personal preferences. Some prostate cancers are very slow growing, and as I mentioned earlier, may never become life-threatening. In these cases, your urologist may recommend active surveillance or watchful waiting. Active surveillance uses regular PSA tests, rectal exams, and biopsies to watch cancer. If the cancer begins to grow, your doctor may suggest treatment, such as surgery or radiation. The goal of active surveillance is to allow you to keep your quality of life. This is often a good choice if your cancer is not expected to grow quickly. Active surveillance can give you years without any side effects that may come from treatment. Watchful waiting is sometimes used to describe the less intensive type of follow-up that may mean fewer tests and relying more on changes in your symptoms to decide if more aggressive treatment is needed. This option is more often used with elderly patients or those struggling with other health issues as well as their prostate cancer. Two other common forms of treatment for localized prostate cancer are surgery and radiation therapy. Surgery, known as a radical prostatectomy, is removing the prostate and the surrounding organs known as seminal vesicles, nearby tissue, and some nearby pelvic lymph nodes. Radiation therapy uses high-energy rays to kill cancer cells. Radiation can be offered externally or internally. When internal, it's most often using implanted radioactive seeds. There are other treatment options available, but those that I've mentioned here tend to be the most commonly used. So how do you determine what is right for you? Get a balanced picture of the pros and cons for all of your treatment options. Learn up front about potential side effects and what you can do about them. Talk to your urologist. Together, you can look at your overall health, the facts about your specific cancer, and what is important to you. No two prostate cancer patients are the same, and everyone's journey is different. Localized prostate cancer is very treatable. Take control. Talk to your urologist and start your road to treatment today.
In conclusion, prostate cancer is one of the most lethal diseases affecting the male space. The disease is mostly asymptomatic and therefore very difficult to diagnose and treat, wreaking much havoc and susceptible population, especially older men and people of certain ethnic backgrounds, such as African American and Spanish. Prostate cancer has attracted most attention worldwide. Prostate the creation of more awareness units that have these measures of preventive measures, aiming at decreasing level of the disease. Thanks for watching.